administration has a lot on its plate for public health, from the recent uptick in Metro Manila's COVID cases to struggles in reaching the target for booster doses. What steps can we expect from President Marcos? We speak now to infectious disease expert, Dr. Rontgene Solante. Doc, thank you so much for joining us. Let's listen now to the President and his views on the COVID response of the previous administration.
There were shortcomings in the COVID response. We will fix them out in the open. No more secrets in public health. Remember, I speak from experience. I was among the first to get COVID. It was not a walk in the park.
Absolutely. The response is not a walk in the park. Dr. Solante, how can the new president fix the COVID response shortcomings left behind by the past administration?
Well, actually, Rico, we already have the blueprint in terms of how did we respond to this pandemic. It's just a matter of, again, prioritizing what we need to do with this new administration. And one of that is we saw how fragile our health system. So probably build on the health infrastructure in order for us, not only for this pandemic, but also for the next pandemic. And that entails really a big budget and financing. Second, we need to review again the vaccination program. There's a possibility that new variants are coming, and I don't see the possibility also that vaccination will end. So in that case, we need to strengthen the vaccination infrastructure of the government if we want to respond and mitigate and decrease the cases. Third is surveillance. We need to continue. We have to equip our laboratories, especially genomic surveillance, because this is only our way of telling us in terms of how we are going to craft our policy in terms of the health protocol, in terms of the alert level system, including healthcare utilization. So these are three important parts of in enhancing the pandemic response.
But doctor, with the new variants, you now have also rising infections of COVID-19, particularly in Metro Manila, and of course, boosting the booster doses for the population. At this point, there's still no one leading the charge. The new administration still does not have a health secretary. How big of a liability is this? Even though, as you mentioned, we already have a blueprint for fighting and responding to this health crisis.
Yes, it's very important that the next leadership of the Department of Health should have that conviction to really put this program in place and at the same time encourage everyone to work with him, unify with him, even to the point of public and private collaboration, just to make sure that there is a very good vaccination rate. Because as of this moment, with the complacency that infections are not severe and only mild, people are not getting their vaccines. But that's not the end. We will really suffer increase in the number of cases, in surge of cases. But again, it's important that moving forward, vaccination will be part of this control of this pandemic.
But how important is it, Doc, that President Marcos appoints the new health secretary now rather than over the next few days? Or maybe it could take another week.
That's a valid point, Mr. Rico, because the transition is really the crucial part there. He has to select his own team. He has to prioritize what he needs to do, especially in terms of selecting his team that he can trust, that has the same vision as him or the same vision with the president, because that's always alignment with the vision of the president. And for that to really happen, it has to happen now, and he has to select that Secretary of Health as soon as possible time. Very important and very crucial.
But if it doesn't happen now, how much of a setback is this to the COVID-19 response and the other medical needs of the country?
Actually, the transition team, there's also the current personnel in the Department of Health that is really taking care also of the current program. No? But again, it should something be that there should be leadership so that everything will be in place. And of course, when you have new leadership, there will be new visions, and that really is important.
What about the needs of the medical workers? How should they be addressed?
Yes, that's also very important, Rico, no, because when we look at health infrastructure development, it cannot exist without human resource. So we need to look at the problem in terms of the shortage of nurses, the shortage of some healthcare workers. What we need to do, we need to talk with them. For example, if the new Secretary of Health will be instilled, he has to have some inputs coming from the ground. What's really the problem, and how he can encourage and engage with these healthcare workers to work with the government or to work here in the country.
Thank you so much for your insights. Infectious disease expert, Dr. Rontgene Solante. Well, sorry.